Thank you all for joining us today for the Alliance of Nurses for Healthy Environments Practice Forum on Medical Waste Incineration. Today's webinar is being recorded and 1 hour of nursing continuing education is available. Participants must complete the evaluation and post-test for credit. We will be sending out directions to the email you registered with on how to access Annie's brand new learning site for those who registered, and that is where you will find the evaluation and post-test, and the video will also be there on demand. Please do put your questions in the chat for our speakers. We hope to have time for question and answers at the end. And I see a lot of you have already introduced yourself. Please do tell us where you're zooming in from, what type of nursing you do, and your name. I'm going to go ahead and introduce everyone. The first two speakers we're going to hear from today are Greg Sawtell and Carlos Sanchez. Greg Sawtell is the Zero Waste Just Transition Director with the South Baltimore Community Land Trust. He has worked on environmental justice campaigns since 2012 in Baltimore, beginning with a successful effort to stop the nation's largest trash incineration from being built less than a mile from schools in South Baltimore. Greg coordinated the development of Baltimore's community-led zero waste plan and is currently focused on implementation in coalition with labor, community, and government. Carlos Sanchez is a youth leader and South Baltimore resident focusing on citywide outreach and education to connect more residents with the movement to create community-owned development in Baltimore. As a student at Benjamin Franklin High School in Curtis Bay, Carlos started learning from environmental justice leaders who founded Free Your Voice. Carlos acted on these lessons by helping to develop Baltimore's first citywide zero waste plan and advocating for new funding for permanently affordable community-owned development. Now Carlos continues to advance environmental justice through research and action while expanding outreach to the next generation of youth leaders. And after our first two presenters, we will hear from nursing and medical experts. We will hear from Deanna Benner, MSN, WHNP board certified. Deanna earned a bachelor's degree in nursing at Villanova University, continued to the University of Pennsylvania, and earned a master's in nursing and became a women's health nurse practitioner, having worked in this role at Christiana Care since 2007. Deanna provides gynecological and obstetrical care to women of all ages and diverse backgrounds and sees patients at Christiana Care in Newark, Delaware, and spends her time seeing patients at the obstetrics and gynecology emergency at Christiana Care. And before joining Christiana, she served in the U.S. Navy Nurse Corps and then worked as a RN in the pediatric ICU at the A.I. DuPont Hospital for Children in Wilmington, Delaware. And last, we will hear from Dr. Jeremy Green, who is the William H. Welch Professor of Medicine and the History of Medicine. Dr. Green is also the Director of the Department of History of Medicine and Center for Medical Humanities and Social Medicine. Dr. Green serves as core faculty in the Johns Hopkins Drug Access and Affordability Initiative, associate faculty at the Berman Institute of Bioethics, and holds joint appointments in the Department of History of Science and Technology and the Department of Anthropology at the Krieger School of Arts and Sciences. Dr. Green received an MA in medical anthropology from Harvard in 2004, an MD and PhD degree in history and science from Harvard in 2005, completed a residency in internal medicine at Brigham and Women's Hospital in 2008, and is a member of the American College of Physicians. And in addition to his appointment at the Institute for the History of Medicine, Dr. Green also practices internal medicine at the East Baltimore Medical Center, a community health center affiliated with Johns Hopkins. So we have a number of amazing experts here today, and I'm going to turn it over to Greg and Carlos for their presentation.
Awesome. Thank you, Sarah. Just to be, hi, everyone. Just want to quickly ask, how much time should we stick to?
About 20 minutes.
20 minutes? Okay, awesome. And do I share screen, right?
Would you like me to share your slides, or will you be sharing your slides?
I can share my slides.
Okay.
Yeah. Okay, let me just 1 second. Actually, you might have to. I don't got sharing access. Sorry.
You do now, Carlos.
Oh, okay. Awesome. Thank you. And just to be clear, everybody can see my screen, correct?
Yes.
Okay, awesome. So thank you everyone for allowing me to be here speak. I'm joined by my colleague that you guys all heard from, Greg Sawtell. We're all from the South Baltimore Community Land Trust. But before we dive into, the main medical waste, I just want to give a little bit of context about Curtis Bay and kind of, you know, everybody can still see my screen, right?
It has gone blank.
Oh, sorry about that. Um, sorry. It would be easier for if you guys send my screen. I'm having some difficulty.
Okay, you can go ahead and get started and I will bring it up.
Okay, thank you. So yeah, so just again, before we dive right into it, the in depth of the medical waste incinerator, I just want to take a step back and kind of share a little bit of context of what Curtis Bay is, and of course of who we are and how we came to be. So Curtis Bay alone, in the whole state of Maryland, is in the 100th percentile, is ranked in the 100th percentile for environmental and health burden in Maryland, and so they're facing overpollution, overburden, and with pollution from toxic industries. And there's in Curtis Bay alone, there's around 100 stationary sources of pollution right next to homes, playgrounds, and even where I went to high school, which is Benjamin Franklin High School. And some of those community those pollution sources looks like the one on the screen. There is an open air coal terminal, but we also have chemical plants, incinerators, trash burning incinerators, medical waste, and landfills, stuff like that. And so we can go on to the next slide, please. And so this is just an example. There's even at a state level or a national level, Curtis Bay is still in the 99th percentile for being close to these kinds of hazardous facilities. And every one of those red dots represents a different air polluting industry. And we can go on to the next slide. And so this is a result of what, being surrounded by so many industries and all of those community impacts, what could happen, especially, not being addressed. And so, this was a picture of the last standing house in Fairfield, which was close to Curtis Bay, and not, and this was now due to the community impacts in that area, it was ultimately wiped off the map, and not just Fairfield, which is this community, but two other neighboring communities, which were Hawkins Point and Wagner's Point. And the medical waste incinerator that we're going to be talking about is actually now where Hawkins Point used to stand. We can go on to the next slide. And so, who are we? Who's the South Baltimore Community Land Trust? Well, the SBCLT for short is a community-led organization that actually started back when youth got together in school to address a concern that the community, what the students had, which was a proposal for the nation's largest trash burning incinerator to be built less than a mile away from their school. And so you heard about the community impact and all of these other industries within the school, and they were going to add one more on top of that. And the students did not want that happening. And so they came together and started to really form this effort to shut that proposal down. And after successfully doing so, that led to a bigger effort, which ultimately created the SBCLT to focus on other issues, just like other community impact issues like the medical waste, the open air coal terminal, truck traffic, as well as addressing other concerns like that the community is facing, like, for example, lack of permanent affordable housing. And we can go on to the next slide. And so this is just a list of like the different things that that we're addressing. There is and if you can see, there is sorry. So one of the things that we'll be focusing on this huge list, a lot of things to do, all being done at the same time. We'll be focusing on the medical waste incinerator, and putting an end to that 3 decades of violations that Greg, I'll pass it on to you to talk more about.
Great, thanks, Carlos. And is everyone able to hear me?
Yes, we can hear you.
Great. Okay, yeah, you can go on to the next slide. All right, and so with Carlos's introduction on the context that the Curtis Bay Energy, the nation's largest medical waste incinerator, is operating in, we wanted to share with you what we've learned, what we're currently doing, and what we hope to do collaboratively moving forward. So as we've noted, it's the largest of its kind in the country. The majority of the waste at this point in the facility's operations is coming from not only outside of Baltimore City, but outside of the state of Maryland. So you can see that number based on recent data, about 76% of the material that the facility's processing is coming from outside of the state. And what we've tracked down over the years that we've been working on this is just an unbroken history of violations and community opposition and worker opposition at the facility. And we're hoping to translate the research that we've done and the community concern into more concrete action. We feel like we're on the right track, and we're bringing to you what we've learned and what we hope to do. So you can go to the next slide. So we made this map based on some annual reports that the company has to submit to the state of Maryland, and we want to understand, has the facility always been receiving its waste from such a large catchment area? Has it changed? How did we get to this point? And what can be done? So we're going to explain over the next couple slides how we got to this point. And really just as you're watching this, what we're trying to ask people that are in a position to act is, just given the track record of this particular facility, and we're also going to talk about, with Dr. Green and others, sort of this whole question of alternatives, but we really want to focus on this particular facility and what their track record is during our presentation, and just think about what it means that such a large number of states and provinces in Canada are continuing to do business with this facility. So you can go to the next slide. So in 1989, around the time the facility started, there was intense community opposition. The community context Carlos shared was very similar then, a large concentration of polluting industry. And the thought was that this, by setting up this one, that it would even lead to even more, which is borne out to be true. Just years into the facility's operations, they wanted to expand. They were bound by local law to only receive waste from Baltimore city limits and then its immediate neighboring counties. And they, though, didn't abide by that. They started to violate that local law, and they were caught. Now, at the same time, they weren't investing in the facility, and literally the facility was in danger of collapse. So that could have been the end of the story in 1994, but for the action of City Council by 1997, when they were successfully lobbied to make what the company was doing that was illegal into a legal practice. So they were in 1997 allowed to expand their area of receiving waste from that sort of local restriction to anywhere within 250 miles. You can kind of quickly, we'll share the slides, but there was intense community opposition, as you can imagine, to that decision. Shortly thereafter, the facility, not once or twice, but 400 times over a 2-year period, was found to be violating their mercury emissions limits. Again, strong community outcry and call for change. 2010, and we just learned this past summer through the youth scholars working on environmental justice research, uncovered current city council wasn't aware of this. City council at the time, many of them weren't aware of this, but in 2010, very quietly, that 250-mile restriction was lifted, again at the company's request. And so that the state then became that they could receive waste from really an unlimited, no bounds on where they could receive. And that's how we started to get that map that holds to the present of literally the waste coming as far away from, thousands of miles away. Then as a result of, so as the facility is allowed to expand despite a track record of major pollution violations, around the time of COVID, the company seeks to receive even more waste than they can process. We understand that a mix of regulatory oversight and whistleblowers from within the company started to really point to even more troubling things happening at the plant. And so specifically, we'll look at it in the next slide, but a long investigation led to the largest environmental penalty in Maryland history, a $1.75 million fine and 40 criminal counts that the company was found guilty of. And we'll just highlight a few of those on the next slide. And so this is what regulators had found at the Maryland Department of the Environment through investigation, is that the facility was trying to receive so much waste and burn it so quickly they weren't actually burning it. They were partially processing it. And then the basic mechanics of what goes on, all the materials coming in, from all over the place. It's then meant to be burned fully, and then the residual ash is meant to be trucked down to 1 or 2 landfills in Virginia. That's the normal scenario, and there's still major concerns if it's operating as intended. But in what they were found to be doing is not actually burning the stuff so that they could process more. And then the unburnt remains were trucked to the landfill, and then workers at the other end of the line at the landfill were manually having to sort through the unburnt stuff and then send it back up to the facility. Other things they were doing is they were illegally discharging fluids onto a nearby public pond, and a number of other things that get up to these 40 criminal counts. And so you can read the statements there from the Maryland Attorney General. This investigation wrapped up in 2023, and then the big announcement was made. It was meant to be, a celebration of strong state action for environmental justice and a substantial penalty being levied against the company. And there's a lot of suspicion at the community level that, given the history, that this was really going to break the cycle of environmental justice. So you can go to the next slide. And so sure enough, this was late 2023 when all that went down in terms of the public becoming aware. By 2024, this is footage that Carlos, myself, and others were literally standing 50 feet away from the facility with a group of Johns Hopkins students that were part of an environmental justice course that we teach. And this is what we found at the facility. So this probably went on for 20, 30 minutes, was just this thick black smoke, not coming from the smokestack, which is the green, smokestack on the screen to the right, but coming out of another part of the building. So we thought the place was on fire. We immediately called the State Department of the Environment, the head of the Air Division, to submit this video evidence and report it. And you can go to the next slide, which led to the community setting up its own monitoring. And all of these images that you're seeing, sort of this film strip visual, are just a few of the dozens of incidences of what we saw on January 26, again, just months after the company pled guilty and settled this major set of environmental crimes, was just on a daily basis violating state law by having these dark smoke visible emissions events. This is not some kind of loophole where they can get away with this. This is illegal, what they're doing. And they did it, and they did it again and again and again. And we know that because we set up a trail camera some distance away from the facility that's taking one photograph every 30 seconds. And then we're able to check it on a regular basis and compile strong visual evidence that we then send to the local and federal government to document the ongoing crimes that the company is committing. And you can see in March 14th, this evidence led to the state issuing, just months after the last one, another state lawsuit against the medical waste incinerator. You can see 3 days after they violated again. You can go to the next slide. This is just, to read it right now, but this is the Attorney General expressing disappointment that even after everything that the state did to try to hold the company accountable, they went on with violating some of the pollutants of concern. And we've not yet paired the visual monitoring with air monitoring, but we know from their own reports, the company's own reports, that they've exceeded carbon monoxide, hydrogen chloride, and particulate matter. We're very concerned about things like dioxins and other toxins that we would expect would be emitted through incomplete combustion at the facility. You can go to the next slide. And we could keep, there's too many of these instances to depict visually in this format, but you can just see basically month after month, week after week, day after day, this is what the facility continues to do. And so now we should probably adjust this. I think we're now 7 months into the current state lawsuit, that even though they're under current enforcement legal action by the state, they're continuing to do the same thing again and again and again. So they're not changing their operations. Next slide. And we won't go through this in detail, but we've done analysis of all of the visual evidence, and we're able to make some statements about the number of events that have taken place. And this is just from a few months, but we've learned that these events go on from anywhere from 1 minute to Some of them are longer than this now, but some of them have gone on for 8 hours continuously of this dark black gray smoke. Can continue. And then we were able to do some wind roses and analysis of wind speed and wind direction. This is one of the time lapses you're seeing on the right. And then we've coupled that with the wind blowing. You can see in this instance, the wind was blowing towards the Curtis Bay community. This is one particular event that we took a note of to bring it back to Carlos's point about the cumulative impacts. This is one day in September. If you go to the next slide, just show you a little bit about what the infrastructure we're building to do community-led monitoring to understand how these different events can stack on one another to create a cumulative burden. So the next day, September 5th, and there was another medical waste event, but this is what was happening at that coal terminal Carlos mentioned. So we have medical waste smoke one day, we've got coal dust pollution, the next day in a very acute event. You can go to the next slide. And then at the same time, we have the trucks that are bringing the medical waste and other things through the community that we've been monitoring and recently published, an article that we can share the link to in a peer-reviewed journal that equated the black carbon levels from the mobile sources of pollution to equivalent to standing next to a major highway. And these are the roads you're seeing there are the two roads that border the community rec center and where the dense residential portion of the community is located. So the point here is that we have many overlapping pollution burdens. They're connected, though, in that the mobile sources of pollution are directly linked to facilities like the medical waste incinerator that's bringing in material from all over the country and beyond. Next slide. And so something we're very proud of is that we were able to translate some of this research, particularly the black smoke events and the history of violations of the facility, and translate that into action. And specifically, in the action that's been taken is Johns Hopkins, who has been historically and continued to be a customer, a significant customer of the medical waste incinerator, decided finally to cut all dealings, cut ties with the facility, based in large part by the community concern that was expressed, backed up by the level of evidence that we were able to present. So this is a quote. This didn't happen overnight. This happened after months of community bringing forth the concerns, and then members of the Johns Hopkins University community being real allies and supporters of public health concerns and community-driven calls for change. Not all institutions that have received the information have taken the same actions, but we're hopeful, you can go to the next slide, that if we're able to translate this information, and this is really what we wanted to kind of put forward to the Annie network and group, larger group, is that the information that we're able to obtain from the state of Maryland, it tells us which states and how much tonnage is coming per state. It doesn't tell us the names of institutions that are sending it, or even within a state, which cities are sending the most. So despite this information, we're trying to use this information limitation as the beginning of an international collaboration to try to identify specific institutions, hospitals, schools that are sending the medical waste, and then do our part to provide the information from the ground, which we really think matters and should matter to institutions that are doing business with this facility, so that they're better informed by what's going on the ground, and hopefully inspired by a mix of what community is calling for and what institutions like Hopkins have decided to do, to really give a hard look at their procurement and decide what course of action to take in the future. But it really starts with an information challenge, which is we're left at this place where it doesn't do us much good to know North Carolina is sending 550 tons in 2023. It's much better to know, for example, institution X, Y, and Z is actually sending a portion of that, and there are people, human beings we can connect with at the institution to really share information from the ground and see where we land. Next slide. And so that's really what we want to bring forward is together we think that we can really finally move forward in another direction after this sort of unbroken 3 decades of environmental justice, and hopefully do it at a scale that's significant enough to make an impact in this aspect of waste management that doesn't get enough attention and that is really having a negative public health impact, not just in Curtis Bay, but in other communities that are on the front lines of dealing with the back end of the way that medical waste is generated and then ultimately burned, buried, what have you. So that concludes the presentation. I wasn't able to look at the chat as we go, and I'm not sure how if we want to do any discussion now, or if we want to go through the full
I think I'm
group
going
of
to turn
speakers
it over
first.
to Deanna and Dr. Green, and we'll get to questions at the end.
Great.
Deanna, I'm going to turn it over to you.
Hi, Greg and Carlos. It's very difficult to follow that wonderful presentation. I have a different perspective here, and mine is how nurses can be a change agent at the hospital to help the outcomes of diverting the waste to better places and reducing the waste. I have a presentation. Let me just pull it up. I have sharing is not turned on. And
You should be able to share now.
so the phone is ringing in, I'm so sorry, is my daughter, who is the reason why I've done all of my work. And she had significant eco-anxiety at the age of 15. So I started to learn all about climate change. And I was so surprised at how much our healthcare industry contributes to climate change, and how we can also be the solution for climate change. So I started to make presentations and present it to whatever leadership I could get to. I'll this down so you guys can to spread this important message about how our industry contributes so largely, but yet how we can also be the solution. And so I got up to our CFO. He actually listened to me, and a form of this presentation I'm bringing to you is what I try to get to as many caregivers. So this is how our waste system, our health system contributes so largely to our issues right now with climate change, but yet we should be the solutions. And with that, at the same time, we had some environmental work that was happening top down, and I started to do environmental work bottom up, and really it was a catalyst for the work to be done when the combining. And since I presented to our CFO when there was an opportunity for an environmental caregiver committee, I was asked to lead it. So I jumped right into the work, and one of the first things that the caregivers cared about was recycling. So I went on this I went to visit our recycling facility, and I realized for years they had been throwing away all our recycling material strictly because it was being sent in bags, and we were never told by our hauler that this was happening. So with that, we started to have a new waste vendor and to have an waste RFP where we started to interview people who would come in and be our waste vendor. So I was allowed to be put on the committee to have a sustainability lens. And I had been researching where all our waste went. And our waste was going to Curtis Bay, all of our biohazardous waste to be incinerated. And then I looked at our landfill waste and where that was going. And I presented this to leadership. And on this committee, I really got to help narrow down the waste vendors that were incredibly sustainable. And the waste vendor that we are going to will no longer be incinerating all of our biohazardous waste. And actually, a majority of our waste will now be autoclaved. So this is such a huge win. And it happened because when we got down to the last two vendors, I went and I toured those two facilities to figure out what was actually happening at their operations, because everybody on paper and through these presentations give lovely presentations. And when I went down, there was definitely one of these waste vendors that was the gold medalist. And the next one wasn't really even on the awards platform. And so when I shared that with our VP of operations, my concerns, he really took my input and he's like, all right, we got to go for the first vendor. I can't pronounce who we picked, but there was a significant price difference. But because of me going down there and touring and advocating, it really helped lead to the decision about which waste vendor. And now we are definitely going with one that is very sustainable and will help us achieve our waste goals. With that, another thing I learned about when I went to the recycling vendor is even when things are recycled properly, it's still not the best. They just told me when I said, where's everything going? They're like, oh, it's going overseas. So I realized we need to do better than just recycling. And I started the medical supply donation program at my hospital. So I linked up with this organization, Project Cure. They distribute supplies globally to resource needy areas. So I started donating and I started getting our nurses to collect supplies. And since February, this program has been very successful. We've saved over $73,000 worth of items that we are now donating to Project Cure. And I inventory all that we're saving so that I can show this number to our hospital leadership so they will fully support this program. And this number can then be used for our nonprofit status as well. And then Project Cure is unable to take expired items and get it through customs, so they were throwing them all away. So then I went a step further and I said, hey, let's separate and inventory our medical supplies that are expired. And I reached out to the nursing schools in the local area and over Tech high schools, and they love receiving these items. A blood tube, they have to pay 80 cents for a blood tube to practice phlebotomy skills. But now we collect all these items, we put them in a storeroom, and the nursing schools can come and use these supplies. So we're decreasing what we send to the landfill. We also, with this, discovered there almost $500,000 of expired supplies. And nurses, you know this, these supplies would just go in the trash and leadership would not know about this number. So this is a really big way that we can reduce our environmental footprint by matching supply with actually what we need. So, and also it supports leadership with supporting these programs. Another thing I started was the landfill diversion program. I found out we had this trailer out back and all of these supplies, they called it the recycling trailer, but actually when I talked to the recycling vendor, all these items that still had use in it that we couldn't use at the hospital, they were throwing away. So now we collect all of these items and then we donate them to our community through Habitat for Humanity. And these are more usable items. I've increased recycling access, and to date with all of these programs, I've been able to divert 15,000 pounds of waste from the landfill. And I find in my work that there is still just a disconnect with health professionals and the knowledge that climate and health are connected. So I started a climate and health conference for health professionals. I talked to the nurses about identifying and eliminating low value care as well. This, helps eliminate our emissions and also continues to keep our leadership involved in these programs. And we're transitioning to paper cups as well. This helps the environment. I've led this initiative. And how I achieve this one is just by going to key stakeholders and telling them about the risks of styrofoam to planetary and human health. And so even though the cost is twice as expensive, we are now switching over to paper cups. And always continuing to educate staff about waste. And in closing, I just have realized that the greatest threat to our planet is the belief that someone else is going to save it. And I think we all have the power to be change agents to help communities like Curtis Bay by changing how we do business at our organization. And I'm really proud of the leadership at my hospital because being a bottom-up change agent, they really have listened to my concerns and value the work that I do. So hopefully this work can be replicated at other hospitals so that we can protect communities like Curtis Bay by reducing what we send. Thank you.
Thank you so much, Deanna.
Sure.
We're going to turn it over to Dr. Jeremy Green.
Thanks so much. And I'm going to keep my comments brief so that we can have time for questions, because, I mean, I learned so much, from Deanna, from Carlos, from Greg. I mean, you're all remarkable in your own spaces, working to figure out how can you take your own tools and use them to actually produce significant headways into what seem initially to be insurmountable problems, right? And so I want to highlight the goals of this webinar, as Greg had put on his last slide as well, which is, here we have Annie, which is this remarkable network in which each of you are actually, in a way, forming your own sites of actions, figuring out how to actually raise attention to sustainability and environmental justice in the places where you are. And part of this, like going back to that first map that Carlos and Greg showed of what it took to actually look at all of the sites that are on the other side of those limbs that all concentrate in the hub of the Curtis Bay incinerator, is that here we have a moment in which many of you at these sites, as Deanna realized herself to be, can actually work on the other end of that connection to actually reduce the forms of harm. And in so many ways, that harm, it comes as a shock. And speaking from within Johns Hopkins, I think it was a real shock to the institution to realize that it was perpetuating unintended, like deeply ironic harm in these very technologies that are supposed to deliver health. And yet, if anyone who came to Johns Hopkins Hospital benefited from the fact that we used a tremendous amount of disposable medical equipment to help people safe, or for reasons of efficacy or for reasons of economic efficiency, that the burden of the harm of who then paid the price of that disposability was not at all evenly distributed. And so, watching, and I just want to highlight maybe 3 points here, right? One is, we've already talked about the hub and spokes and what we can do together and how we can all learn from your collective experience. If you find yourself, members of the audience of this webinar, to actually be located at an institution that is actually transporting its waste to Curtis Bay, what you can do to actually tell those stories and raise attention from your own site as well. Because part of the problem is that we've all been able to perpetuate this problem by this notion that waste is something that just goes away. And the whole system of how we think about waste is intended to actually allow us to forget about it and to naturalize it. There's a field of study that tries to move away from this. It tries to talk about discard studies rather than waste. If waste is something we think of as natural, discard is an action. And how is it that we decide to discard all of these things rather than find ways of reusing them or repurposing them? And then how is it that certain sites, certain spaces are considered spaces of discard, as Carlos and Greg point out, where a lot of forms of harm then get concentrated. And then the concentration of that harm also is seen as just sort of a natural way that the city or that our society has actually built itself. So this all comes down to this fundamental point, which for me as a historian and an internist, I kind of keep tacking back and forth between what I see in my clinic and my community health center, and then what I see when I think back in time of what one can learn historically. Does it have to be this way? Or rather, I could point to a time 60 years ago, many of you might remember, when the average expectation for medical technology were to be reused. I could point you to the room in my clinic in the community health center, which is a ruin now. It's an empty room, but it's where the autoclave used to be. So we were capable of practices that actually had built a much more circular economy of healthcare than the one that we have now. We've naturalized this one, and we think it's inevitable. And I want to come back to a point that Deanna is made earlier, that there's a pragmatic problem a lot of healthcare practitioners will get into, is a form of resistance of saying, well, it'd be great if we could make a more sustainable healthcare system, but we're not going to, the first person that gets a nosocomial infection because of that, that's just going to scuttle the whole thing. Or if it's just even a few cents more expensive per patient, then the healthcare system is not going to be able to handle it based on margins. And I think that so many of the things that Deanna highlighted in her story illustrates how it just takes a moment of challenging those assumptions and seeing what it takes to actually drive changes in practice. And all of these things are not fixed inevitabilities of the world, but are the world that we've decided to accept as it is, and they're the result of human actions and decisions over time. So much of this is highlighted so brilliantly, not only within the citizen science that the folks at SBCLT have been doing with these camera documentations, inexpensive, easily mobilized and available to a community, right? But also with the citizen, humanities and social science of actually getting into the newspapers, getting to the archives of the city council, digging up the history, showing that the way that the world is right now is a result of a set of decisions that were either tolerated or were protested, but were then forgotten and can be re-examined today. So these are powerful tools that can be used to question the world as it is and make the case for change. With that, I want to make sure we have time to actually think about these other lines in the hubs and spokes. So I'll exit just by saying that power lies in what we take for granted, like those things we learn not to think about and are in the mundane assumptions of every day and the things that we don't think can be changed. And really every piece of what we're talking about, from what we actually use when we talk about the need to have a disposable gown or a disposable surgical tray, all of these things actually can lead to change that result in less waste going into incinerators that are directly, affecting, differentially affecting the health of our communities. So how we actually call attention to these things that our attention is consistently led away from, and then build and maintain that attention. This is the basis of change making that all three of the panelists so far have actually successfully built on, and would like to learn from the rest of you in the space as well.
Thank you so much, Dr. Green. Just looking at the questions in the chat, Deanna, there was a question here about how can your initiative at Christiana be scaled up to other organizations? Do you have any ideas on that or suggestions?
I was in the Navy in the beginning, and the Navy's saying is it's easier to ask for forgiveness than permission. I kind of use that to be a change agent. And I just started going into the basement and just learning how my hospital worked and just snooping around. And I know there was lots of times when I'm like, oh, that NP is coming down again. She just needs to stay in her swim lane. But I just started to make friends down there. I started to follow like where waste went and asked a lot of questions and made friends along the way to start these programs. And every one of them can be replicated. I called Project Cure. I just picked up the phone and said, hey, will you guys come and collect our medical supplies? And they said yes. And then I connected with the people in the dock and I said, okay, they're going to come and we're going to collect supplies and they're going to pick them up. And then for the landfill diversion, I just called Habitat for Humanity and I scheduled it the same way. And then all the same time, I keep making presentations at the hospital and I keep putting all of the work that I'm doing and I'm tabulating as much of it as I can to tell leadership the financial value of these programs. And then my message is to everybody that I speak to is I'm just one NP who's really concerned about the future for our children. And I want to make sure that you guys know that your power to enact change far surpasses mine. And if we all work together, we can really make significant change on making health the heart of climate action and protecting communities like this.
Thank you so much, Deanna, for the nursing.
And I'm so sorry, I'll have to jump off early, but I'm going to put my email in the chat and everybody can contact me if you have any questions or you comment.
Thank you. Dr. Green, I think this question might be something that you might be able to speak to, where the waste is going now that it's not going to Curtis Bay from Johns Hopkins. Is that something that you would be aware of?
Oh, I'm glad this question, and I'd love to bring Greg and Carlos and Deanna into this as well, which is to say that's what we got to keep our eyes on, right? So on the one hand, it's great that Hopkins can recognize the harm it had been doing unintentionally and move to change that. And not all institutions in Baltimore have actually made the same decision. And there was the city council meeting in March was kind of fascinating and the stark relief. But if Hopkins merely just pushes that risks onto other people who happen to not be in the city that it's in, that's not over. Then we just become the other end of that spoke. So I do think that we are holding an event next month about the values of disposability, which is trying to get at these questions of that Deanna actually labeled of how do we get the average practitioner to understand that it's not all dichotomies, right? That there's a lot of areas we can make change in quickly. Like sure, some forms of disposable are necessary to avoid some forms of infection, but not all of them, right? And so one of the panels that's there is Stericycle, who is Hopkins' major waste contractor, will be present at, and will be open to actually explaining what it is that they're doing. So the bulk of it is shifting to autoclave and ozone approaches, right? But that if some of it will be incinerated in Hog Island, well, then what is that facility? What's happening there? Like, how do we make sure that we're not just displacing one form of environmental injustice in one space to another? Greg, I'll cede to you on this. I know you have lots to say about this too.
Yeah, I mean, I think we're not at a place where we've shifted ultimately to the community worker institutional governed transition. This is an interim step. And I'll just say one thing that it comes back to transparency that's been difficult, is really having a quick answer to that question, which is exactly breaking it down by percentages and tons. Where is it all going? And that speaks to the fact that we're in this place where we need a larger, collective effort to do, among other things, shift the way procurement decisions are made and have not get to the point where 30 years after things go horribly wrong, do we have a corrective, but we have decision-making structures that incorporate community knowledge, on the front end. So we're not in reactive mode. I also just wanted to add to Deanna's amazing presentation that I think a big part of this is another one of the knowledge gaps is even knowing that ecosystem of waste diversion and reuse exists. And it doesn't exist at a centralized level, and it looks different depending on where you are, but it's most likely out there at some level. And so realizing that it isn't just a giant leap of faith to start a conversation at the hospital and say, hey, something bad has happened, but I have no idea what the alternatives are. It's also not a story of saying this is exactly what the alternatives look like in your area. But Deanna's story is really similar to what folks who go on the zero waste journey outside of the medical waste domain find, which is there are people out there tackling this, but they're not well funded and they may be very well organized, but they don't have a huge budget to get the word out. And so it's realizing that it's an opportunity to it just helped reframe it for me. And that mostly what we confront in this, well, is it going to cost more? And I heard that in Deanna's presentation, but it was also opening up all of these relationships and possibilities to do an awful lot of good with materials that are being fed to what's essentially a large capital investment in a big smokestack. Whereas these are still materials that have value, and that breaking open the conversation beyond burn and bury is an opportunity to do an awful lot of good. So just I think that's a critical part, is us embracing this as an opportunity to find a lot of really meaningful connections.
Thank you so much. There was another question in the chat about what is being monitored in the air and soil, and I assume that means around the Curtis Bay facility. Greg or Carlos, do you have any information on that?
So in terms of I can answer this in a couple ways. We have very limited capacity, and so a lot of our community monitoring work that gets into those questions has been focused on the giant coal terminal because it exploded and it's a huge community priority, et cetera. So given unlimited resources, we'd be doing a similar intense effort at the medical waste incinerator. What we've been able to do, and partially this is also because of how flagrant the visual violations have been, is that it doesn't take an expansive, it takes a $70 trail camera, to be frank, to do an awful lot of good in terms of the monitoring. There's lots of questions and concerns about what is being emitted. Some of that is coming out in terms of the state investigation from their on-site monitoring. But if we had more resources and capacity, we would be doing multi-pollutant monitoring, at the facility and really trying to dig into it more. But as of now, we don't have active air monitors or soil monitors or water testing going on, so we can't give specific answers, unfortunately.
Thanks so much. And I see Dr. Green dropped some articles in the chat, so folks could check those out. There was another question about one of our nurses said in Miami-Dade County, they're proposing to build a large incinerator, not specifically medical waste necessarily, but are there any parallels between medical incineration and just general incineration to convince them not to build it for health impacts?
Yeah, Carlos, I don't know if you want to jump into, but that was very similar to the incinerator that we were able to stop, 15 years ago, or it was proposed 15 years ago. It wasn't medical waste; it was a general, municipal waste incinerator, and it's a very similar in that it's essentially a pre-disposal step that generates lots of air pollution, and that you're burning the material, you're turning it into ash. It still has to be landfilled, and so that's one piece. It's a very costly way to do that. It's incineration. We can send this information out, but it's a very costly, inefficient way to produce energy that compares unfavorably to coal. That's another big point. As another person in the chat noted, most of what's being burned is fossil fuel petrochemical derived, so it's mostly plastics on the side that is difficult to find alternatives for. A huge thing that's been gained traction in Baltimore, though, is that a big chunk of what's being burned is food waste and organics, for which there's no rationale for burning it, right? And so to generate a healthy soil, we need compost and soil amendment. And if we're burning all of that material, we're not only putting it into the air, but we're also depriving the soil of nutrients that we need to have a healthy soil ecosystem. So there's way too many. We can point you to some really great resources. The big network, though, is called Gaia, which is the Global Alliance for Incinerator Alternatives. So if you look up Gaia, there's probably a group of folks that are connected in some way to Gaia in Miami-Dade working on that issue already. And if not, then connecting with the network would be a great next step.
The only piece I wanted to add here is this element of how, it used to be that every hospital or clinic just had their own incinerator, and their own incinerators were meant to handle, not handle plastic, right? To handle pathological specimens and tissues and so on. And so the damage was minimal, but it was also dispersed across every health institution. And Greg and I have chatted a bit about this. Like, partly what we're dealing with is an aftermath of the changes after 1989. The similar thing that led to the actual construction of this large medical incinerator in Curtis Bay led to this consolidation of medical incineration as something that happened in a small amount of places of concentrated harm in the country, rather than diffusely spread across every health facility, because we made the decision as a society that we couldn't simply put in clean, high-burning incinerators in every single health care facility. So this idea that we adopted a model of concentrated risk, kind of like what you're talking about in terms of Miami-Dade County, rather than understanding sort of a dissemination of risk. And then also, to underscore the point Greg was making just now, many of you know the stats. A lot of this comes from healthcare waste audits, from healthcare without harm and others. But there are forms of medical waste that are uniquely hazardous for either for biohazard regions or radioactivity or toxic chemicals. That's only about 15% of the total amount of healthcare waste, and about 85% of that, which includes organic scraps and stuff that's all just bundled in there. It's just stuff that we just throw out, but it gets labeled as medical waste because it all gets bundled together, and then it gets funneled into these areas of concentrated harm. And so it's not even just reducing, but also like reclassifying what we understand medical waste to be. We've done something putatively to help people by regulating medical waste that has actually caused a very wasteful system to become exaggerated in the intervening years, and it doesn't have to be this way.
Thank you so much. Yeah, and there are groups like Healthcare Without Harm that have a lot of tools that can help facilities look at their waste streams, and they have sustainable procurement guides. So those are definitely good resources. And I see also that there is a November conference about the International Plastic Pollution Treaty, because at the end of the day, all of these are, the petrochemical source of a lot of these items. So thank you, everyone. Are there any additional questions? I think we got to everything in the chat. But we want to really thank our speakers today. This was really informative, and this is a topic that I think a lot of people are learning a lot about. So we thank you all for joining today, and thanks to our speakers. You will receive an email from our organization about how to log on to the learning site to get continuing education. Oh, Carlos, you have a question.
Yeah, as well as like a statement, was just hearing the questions and all of that, the interaction in the chat really does mean a lot. I want to thank you all, and as well as Sarah, everybody who made this possible as well. Thank you all for allowing us to be here, sharing, and it really means a lot. I will really appreciate hearing from any of you who want to help out, find out if your institution sends waste to Curtis Bay. I know it might be a little like time constraint, but I'll put my email down in the chat. We can communicate offline.
Wonderful. Thank you so much. All right, have a great afternoon. Thank you.
Thank you. You too.
Thank you.